You are listening to You Restored with Dr. Kelley Reis. To listen to all episodes, visit libertynaturalwellness.com. I want to talk about something that most people in the holistic world avoid. And that is, why are people still as sick as they were before? I want to start with the conventional side of things. So, you have high blood pressure. What do? Okay, I'm going to choose the best doctor that I can, conventional. And you go in, you spend, 8 minutes with them, and they hand you a pill, and there you go. That's your blood pressure fix. And half the time, honestly, guys, you go in and they take your blood pressure and it's elevated only because you're in the doctor's office. But naturally, it wouldn't be. But that's a whole different podcast. So you were given a pill. You were given 8 minutes, maybe, if you're lucky. I think the average is 7 minutes. Given just a few minutes of the doctor's time, it's really walk in with the script pad in hand. We're used to hearing that. So you're like, I want something better. I want something different. So now you seek out a holistic practitioner. And that holistic practitioner, you go in, you get a lot of time, which is what I love about holistic or functional medicine, is that, it would be rare not to have a practitioner really spend a lot of time with you. So you go in, you're heard, they listen to you. They may even run some great tests. And then what do? They write up a protocol with thousands of dollars worth of supplements. Now, do not get me wrong. I use supplements with my clients. Supplements are not a bad thing. I just think they're overused. So now the functional practitioner ran some tests. I love those tests too. Ran tests, hands you a protocol of a lot of supplements, adaptogens, blood pressures, vitamins and minerals and herbs. And you leave and maybe you start feeling better because you've adjusted your diet and have done some things that you didn't do before with the conventional doctor. So now you're taking all these supplements and you feel better. But then your blood pressure starts creeping back up. And you're like, okay, well, maybe I need more tests. Maybe I need more supplements. And I see this cycle all the time. I can't tell you how many times I see clients who have seen, first off, their conventional doctor or 2 or 3, but now they've seen 5, 6, 7 functional practitioners. And they're not any better. They're still fatigued. They still have high blood pressure. They still have hormones that aren't balanced. And this is, what I'm seeing that's really frustrating to me is that functional medicine, I'm just going to move over to functional medicine now here and talk about that. Functional medicine is becoming an industry. People are being trained with maybe a weekend course and hanging that shingle saying, I'm a functional practitioner. And they don't really have the guts of the training, but they've learned, I can run this test, I'm going to sell this test, and I'm going to sell this supplement pack that goes with this test. And people aren't getting better. It's really no different, slightly different, but really no different than the conventional world. We are still treating symptoms. We are treating just a simple lab result with a supplement. And it's coming from a lot of relatively, do I want to say untrained? Not really untrained, but not as well trained as, board certified naturopathic physician like myself. And it's kind of muddying the water of holistic health because people are getting disappointed and spending all of this money. Duh, of course you are. Spending all of this money and not getting the results that you're usually promised. And root cause, it's such a term thrown around that, oh, it's root cause. But are they treating root cause, or have they just taken courses at all of the functional medicine training programs that also train these providers how to sell supplements? So now they're selling you big supplement stacks and you need all of these things and you're not getting any better. As I said, I do use supplements and I use a lot of those tests that these other providers use. But my expertise comes from deep physiology. I mean, guys, I have 22 years of, practice as a naturopathic physician, 5 years of naturopathic medical school. So, I have years and years and years of experience at getting to the root cause. But what is the most important thing is so many functional providers will throw an adaptogen or try to supplement you out of stress or deal with stress through supplements. And it doesn't work long term. I mean, do supplements help to some degree? Absolutely. But if you're not correcting your behavior that is causing that stress, that constant stress, no supplement's going to get you out of that. But what is missing the most in functional medicine is the relationship, the partnership. I run those tests, as I said. I use supplements. I use supplements to correct broken pathways, not to supplement a symptom. On occasion, there's a supplement that might help a symptom. But overall, using supplements to fix broken pathways that I've uncovered through testing. So I love the testing. I love the supplement idea. But what is missing is there is no real relationship between the provider in the functional world and the client. And that is the most important part. So I prioritize the relationship. And that helps my clients get farther along than, they did with the 5, 6, 7 other functional providers that they worked with. I had one client one time put on my desk, it covered half of my desk, all of the supplements that a previous functional provider put her on. And she was taking them all at once. That is absurd. That is absurd. And what a waste of money. So, the relationship, being able to bounce ideas back and forth, like helping you move forward, that is the crucial part. Not just, I'm going to test, I'm not going to explain the test, I'm just going to give you a supplement stack and then come back every 6 weeks. That is such a broken system. It's just as broken as conventional medicine. And people are frustrated. They don't want to throw their money away. And I don't blame you. Who does? But to understand, to be taught how to get yourself out of the health predicament that you're in is crucial. Figuring out why you were in it. So the education part, the guidance, it is so important in holistic medicine. And most doctors miss that. They don't even, talk to their clients about why they're prescribing all of the supplements that they are. So it is absolutely important to prioritize the relationship for a client to get better. And that then you can kind of tease apart, like, not everybody is going to get the same results from fixing broken pathways with supplements. And everybody has a very individual health background / picture of why they are not improving when their friend is. So talking through that, understanding that there are these nuances between people and that everyone is an individual and has to be treated as such. There's so many functional medicine protocols that are simply such a waste of money. And everybody gets, should I be on all of these things? Absolutely not. You should only be on what you need to be on based on where your labs fall. and what your symptom picture is, and what your lifestyle is, and what your diet is. If you're not going to fix your diet, there's no point. You can take all the supplements in the world. You cannot out-supplement a bad diet. So prioritizing the relationship and getting real with your holistic practitioner, most of them don't do it. That is, in my world, the most important thing is prioritizing that relationship. But I want to tell you something that's probably even more important than that. It is, if you are not ready to do the work, you will not get results. It's not just about taking your supplements. It's about changing your diet. It's about changing your lifestyle. It's about changing your entire stress response and, every aspect. But if you're not invested, there's really no point. I don't mean to be like, a Debbie Downer here, but I'm a realist. And I think you need to be, explained and taught that you are the most important component of the protocol. You taking your health seriously and understanding, getting away from the system of meds, even if those meds are supplements, like the one pill fix. I want a pill to take care of all of this. I just want a natural pill. If you're not willing to do the work, you can't expect to get the results. So I need you to be willing to do the work. So I'm Dr. Kelley Reis, and this is You Restored. I'll see you next week.